I want to thank everybody for joining us this morning for an update on where North Carolina is in our fight against COVID-19. As of today, North Carolina has 11,848 cases, 498 people in the hospital, and 430 deaths. Our death toll is rising slower than in many places, but we mourn all the same for those who've passed, and we keep all of their families and friends in our prayers. We're continuing to see progress on testing, tracing, and trends. We're hopeful we can enter phase 1 this weekend. However, please know that the success that we've had so far in flattening the curve is due to the work that North Carolinians are doing to stay at home as much as they can, to sanitize, and to keep their physical distance between themselves and others. We can lose ground quickly and cause many more deaths if we don't keep doing those things. Today I'm joined by leaders of the North Carolina General Assembly, and I'll sign 2 bipartisan COVID-19 relief bills that they passed this weekend, providing over $1.5 billion in emergency funding. This is a time that North Carolina has truly come together to fight this disease. These new laws were passed unanimously. Every Democrat and every Republican supported them. I appreciate these leaders reaching consensus with each other and our office to move quickly so that we can test and trace this disease while we also get relief to people and businesses that need it. This emergency funding is just a first step. There will be more work ahead. We need it to repair the damage that has been done by this virus and to look ahead at how we can prevent illness in the future. Early on, we worked together to identify where the state could provide resources from North Carolina's most immediate needs: public health and safety, education, local governments, and small businesses. We know that many small businesses have felt the economic pain caused by this pandemic. Today, I'll sign into law $125 million to help small businesses through a loan program run by the Golden Leaf Foundation and the North Carolina Rural Center. Small businesses are the backbone of our economy, and they deserve our support right now. This crisis is also shining a light on health disparities that have long existed. This legislation includes $50 million for health programs in underserved communities, including our rural areas and minority communities, particularly hit hard by this virus, and that have historically had less access to health care. We know that the sudden shift to remote learning has been challenging for some students and families. Today's bills provide for feeding school children, summer learning programs to help them catch up, and funding to purchase computers for students who need them. It modifies end-of-grade testing requirements and adjusts the public school calendar for next year. The bills I signed today also help hospitals, healthcare providers, first responders, COVID-19 research efforts, and more. They extend driver's license and registration deadlines and waive interest on tax payments, normally due April the 15th. There are more needs, and we'll continue working together to provide additional relief for unemployed workers, people who don't have health care insurance, and other at-risk populations in this time of crisis. I hope the spirit of consensus that brings us together today will continue. I'm joined by the Senate President Pro Tem, Phil Berger, Democratic Senate Leader Dan Blue, the Speaker of the House, Tim Moore, and Democratic House Leader Darren Jackson. I'd like to recognize each of them to say a few words, and then we will all take questions. I'll first recognize Senator Berger.
Governor, thank you, and I want to thank the other political leaders that are in front of you today for the work that's been done on these 2 bills. North Carolinians have come together, and what you have seen is the leadership in the General Assembly and all members of the General Assembly together with the governor and various executive branch agencies come together as well. I believe this bill gets us on the right path. And I am looking forward to continuing to work, Governor, with you and with my colleagues in the General Assembly. Thank you.
Thank you, Senator Berger. We'll now hear from Democratic Senate Leader Dan Blue.
Thank you, Governor Cooper, very much. I, too, like Senator Berger, believe that this is a very important step in helping North Carolina move beyond the COVID-19 pandemic. I'm proud of the work that we've done in the Senate to help to address the pressing needs of our state. And indeed, I'm proud of the work of the General Assembly. The bipartisan work that we have accomplished shows us what we can do when we put people above politics. I look forward to continuing to work with Senator Berger on the next COVID-19 package and as we go through budget deliberations this summer. I'm also proud of the efforts made by North Carolinians who are doing their part to slow the spread of this disease. Keeping our distance, staying at home when we can, wearing a mask, and washing our hands more often. By doing that, you have helped in a tremendous way to save numerous lives here in North Carolina. The restrictions placed on us haven't been easy, as many of you know, and we tend to get restless. But we need to understand that for each person that steps up to take these guidelines seriously, many, many lives are saved. The pandemic is unlike anything we've ever seen before, because a little more than a century ago, we had the same experience. And we practiced social distancing. But as is sometimes the case, we got a little restless, and the second and third phases were more deadly than the first phase. So I know that when I learned our lessons, we in the General Assembly, with the governor's guidance, have taken steps to make investments in the public health systems of this state. And that's evidenced by this bill that the governor is going to sign. And I think that we will learn the lessons and we will get through this pandemic all working together. Thank you again, Governor.
Now I'll recognize the Speaker of the North Carolina House, Tim Moore.
Thank you, Governor. You know, when COVID-19 came on the scene a few weeks ago, members of the House came forward and said, we need to see what we can do. We appointed a bipartisan task force of committees to deal with all facets of life that have been affected by this. Those of you watching this know how your personal lives have been turned upside down. Those in the business economy know that. And so we know in government we need to do what we can to respond to that. As a result, we passed in a unanimous basis legislation that appropriated a little over $1.5 billion of the federal money from the CARES Act to those needed services. We put money into local governments, education, hospitals, healthcare providers, loans for small businesses, and many other entities that we knew we needed to fund. It was an experience by having folks come forward and come to the committee, bring information, where I think we've done a really good job in making sure that we're getting those resources out there to where they're very much needed. I wanted to thank the work that's been done by all of the agencies, by our healthcare providers who are on the front lines, and particularly for those folks in education who are now having to teach our students in the state in a very different model than anything that's been done before. It's been very refreshing to see everyone put aside whatever differences they had or thought they had and be able to work together for the common good and make sure that this legislation went forward. So I'm very proud of where we are today. Appreciate the bipartisan spirit in which both the House, the Senate, and the governor approach this, and know that we keep working together, we're going to get through this. Thank you.
Thank you, Mr. Speaker. We'll now hear from the Democratic House Leader, Darren Jackson.
Thank you, Governor. I think the citizens of North Carolina expected us to come together with some bipartisan consensus, and I think today we're demonstrated we're off to a good start. I want to thank the Governor for his leadership, Senator Berger, Senator Blue, Speaker Moore. As I stand here today, I know this is just but a start. I'm already thinking about what's in the next bill that'll be coming down the pike. Science tells us there'll be peaks and there'll be lows, but this virus is not going away. And no matter how things change, there are some issues we need to continue to constantly have on the forefront and address going forward: the need to expand healthcare access and close the insurance gap, the need to protect our frontline healthcare workers and other workers, and make sure they have the protection that when they get sick, they can stay home, that safety net. We need to help the unemployed who in an instant lost their jobs but may find that job not coming back in the near future. Today we take a good step, and I hope it is just that, the first step, and I look forward to working with you all on the next relief package. Thank you, Governor.
Thank you, Darren. Now I will sign these two pieces of legislation. Okay, we have two new laws that will help the people of North Carolina, that this leadership has come together with consensus to move our state forward, and we're grateful for that, and I've got a pen for each of them after we wipe it down with disinfectant. So, I appreciate the words that people have spoken today. We also have with us our Secretary of Health and Human Services, Dr. Mandy Cohen, our Director of Emergency Management, Mike Sprayberry. Lee Williamson and Brian Tipton are our sign language interpreters, and behind the scenes, Jackie Mativier and Angie Chivoni are our Spanish language interpreters. Now, any of us, or the people that I've mentioned, any of these legislative leaders, myself, will be glad to take questions. So if you can, when you call in, if you can identify yourself and your organization, and we'll take the first question.
Our first question will be from Dawn Vaughn with the News and Observer.
Hi, thanks for taking our questions. With the restrictions potentially lifting at the end of the week, can you talk about how much more freedom people will actually have under phase one? Aside from the state parks, are there any businesses that could open that aren't already open? And are you still encouraging people to stay home except for work and shopping, or can they gather in groups of 10 or less once that starts?
Very soon we'll be announcing the specifics on phase one. We're still analyzing our indicators, our testing, tracing, and trends, talking with healthcare experts. We're getting a lot of advice from businesses about what we can do. So we will provide all of that information maybe by tomorrow, or certainly at least by Wednesday, but we're hoping by tomorrow we can provide all of that information on what we're going to be doing in phase one, and we're still hoping that we can get to phase one because the order will end on May the 8th. Thanks. Next question, please.
Travis Fain, WRAL.
Thank you. My question for Dr. Cohen. I'm curious, as we've done contact tracing, and of course, I'm sure you're looking at studies and contact tracing from other states and around the world. What are we seeing about what sort of activities are safer than others? I mean, obviously, there's a difference between, say, walking a trail versus kids on a playground versus eating outside versus eating inside. Are there going to be some recommendations about what the relative amount of risk is in various activities?
Thanks for that question. And so as we've outlined at a very high level in terms of phases of activity, I think the first thing to remember is that there are three core things we want folks to do no matter what. One of them is to continue to remain physically distant as much as possible, 6 feet apart. That's number one. Second is going to be about wearing a face covering. So if you're going to be with other people, is wearing a face covering. And then also to be washing your hands. As far as activities in terms of risk and not, we certainly know that indoor activities are higher risk than outdoor activities, and activities where you sit for a prolonged period, stand or sit for a prolonged period of time, but generally sitting for more than 10 minutes, that's the things that are going to increase our risk. So the CDC defines risk, and particularly the higher risk of a contact, as someone who is within 6 feet of distance for more than 10-minute period of time. So that's where you're going to see, as we phase through these activities, we're going to start to ease restrictions, and the things we'll encourage more first are the ones that are lower risk activities, where you're going to be less in contact with people for more than 10 minutes at a time. So there'll be more activities that are going to be in the, activities that you do walking around, commerce, going to parks, and such. So stay tuned for additional details on that, but that's the high level. We're looking to minimize that in close proximity, less than 6 feet for more than 10 minutes of time. And then when you do that, if you have to be in closer contact, again, to be wearing face coverings and to be washing your hands very frequently. Thank you.
Thank you. Next question, please.
Kate Martin, Carolina Public Press.
Good morning, Governor. This is Kate Martin with Carolina Public Press. Thank you for taking my question. Of all the deaths that have been reported so far, nearly 60% of them are among some of our most vulnerable residents, people who are in nursing homes, rehabilitation facilities, and jails. The workers who keep those congregate care facilities running will be getting exposed to COVID-19 as these restrictions relaxed. I'm interested in hearing from both parties what legislation is being considered to ensure these essential workers can stay home when they're sick so they don't expose more people in these facilities. Thank you.
We know that there is a much greater likelihood of transferring this virus in our congregate care facilities. That is why we have put an emphasis on those, with restricting visitors who can come, with increased sanitizing, with increased social distancing, and with increased testing. It's been very important for us to go and find out who is positive in a congregate living facility so that we can separate them and have separate staff to look after them. We're also encouraging all employees, if they feel sick, to stay home, and encouraging employers to make sure that they allow that to happen, because as we ramp up our testing, which has been very important thus far, we can do more in these congregate living facilities, and we can test more people who are feeling sick. The guidelines have been expanded so that we can test more people. So it's critically important, even as we ease some restrictions and go into phases, you will notice that our congregate care facility restrictions don't change any, because it's important to make sure we continue to provide that kind of help to those facilities. Would you need to add anything to that, Dr. Cohen? Either of you guys like to talk about response?
Thank you, Governor. I think the thing that we've got to realize is that depending on where people are, the protocols need to be different. And in the congregate care facilities, obviously the protocols need to be different for the people who reside there, but also for the people that work there. And our ability to test both the patients or the residents and the workers is extremely important. Also, the ability to have access to appropriate PPE for the folks that work in those facilities is critically important. This bill actually has a significant amount of money for increased testing, but also for increased PPE, to the extent that it's necessary for us to move forward with additional funding for those things, for those facilities or for other facilities. I'm sure that the General Assembly will be in a position to do that.
I was just going to mention the fact that I think the question, or one of the questions we need to get to, is when you have these workers who are probably making minimum wage or not much more than minimum wage, and they have to choose between going to work and not getting their paycheck, are going to work and maybe having a slight fever. So maybe they take a Tylenol before they go in so they can pass the fever screening. So we need to do something on the state level. We need to encourage our employers to make sure their employees know that if they're not feeling well, they can stay home and that they will still be compensated so they're not having to make that difficult choice. I think that's something that they've looked at addressing on the federal level with some funding, and I think that's something we should consider on the state level as well.
Just to add to that, the passage of this bill actually provides those resources so that we'll have all of that. The availability of PPE, the money for the testing, the money for the research that our universities in the state are doing. A lot of money being put there to really help toward developing treatments, to developing a vaccine, but also for the short term, the efficacy and treatment, things that need to be done. And as I've told the governor and others, I certainly want to see our state opened as soon as possible, that it can safely be done. And I think that investing these resources to make sure everything is there at the healthcare front is critical. And so I'm glad that we've done that. And certainly anyone who is of either because of age or underlying health condition or because of where they work is subject to either contracting or spreading this needs to practice additional safety and additional precautions. So I think you'll continue to see enhancement of that and making sure that we work closely with the executive branch in those laws being implemented.
Thank you. Next question, please.
Michael Hyland, CBS 17.
Hi, this is Michael Hyland from CBS 17. I wanted to ask you, this morning we saw that just over 1 million people in North Carolina have filed for unemployment benefits since the middle of March. There was some discussion of including a provision in the legislation that you just signed, Governor, that would have increased unemployment benefits to a maximum of $400 per week starting in August. So I want to ask you and the legislators on the stage there if you all still support doing that at some point, and when could that happen? Thank you.
Thanks for that. Unemployment insurance is critical for families hanging by a thread, and they are almost at 500,000 people, claimants who have begun being paid in the system right now, but we have more filing every day. So it's important that we get that to people as quickly as possible. I think what we wanted to do with this legislation is to pass a consensus piece. I think that there is some disagreement about how much and for what period of time we would do unemployment insurance. I obviously believe that we should expand our state unemployment insurance, and there was some talk about doing it in the General Assembly this time, but because it was controversial and because we couldn't reach agreement, that's been put off to a later time. So I'm hoping when the General Assembly comes back that we can address this, and I'll let our colleagues here address that too, if you want.
Thank you. As you know, we unanimously felt that way in the Senate, and I think that over time, these few weeks that we're out, there will be consensus in both chambers. Conversations have begun with many of the interested parties already as to how we expand these benefits, especially once the federal benefits end toward the end of July.
We certainly want to assess where we stand as far as our unemployment insurance trust fund. Going into this, we had about a $3.9 billion balance in that account, so we're in great shape. But we also know those resources are being drawn down in a pretty significant manner. So our thought is to take a look at this as we go through the next few weeks, assess where we are, and certainly open to consideration of all options. But we want to make sure that these hardworking North Carolinians who have lost their job through no fault of their own are entitled, get the resources to which they're entitled, and that they do so as soon as they can.
Just briefly, Michael, I think you'll see that we'll have another opportunity to look at this, and I'm optimistic that we'll be able to move in the direction that that the Senate had in its bill. There were some questions about whether or not the solvency of the system would be impacted. I believe that we're in good shape as far as that's concerned. We will again, as I said, have an opportunity to revisit that issue.
Thank you. Next question, please.
Rusty Jacobs, WUNC.
Yeah, my question first is you kind of addressed this with the unemployment benefits, but you've got more than $1 billion still left in federal monies to disperse, and then there's $3.5 billion or so in state reserves. I wanted to hear from Governor Cooper and from the legislative leaders, in particular Senator Berger and Representative Moore, what might not have been covered in this first law that was signed today. What are the priorities going forward with the rest of the money there is to disperse, and will there be the same level of cooperation going forward, maybe even to non-COVID related legislation?
I think as it comes to unemployment insurance, we really need to look at what we're going to do after the federal money ends. And so I think we need to think about the length of time that we can pay these benefits and making sure that there's enough time for when we are requiring people to look for a job to get back to work, that there's enough time so families won't be in trouble. Also, our state amounts are quite low as compared to the national rankings. So particularly with federal money going away, we need to look at whether we want to up the amount of insurance that we want to provide for people. And this, I think, was done in the Senate bill, but we've still got a point of disagreement on that. I also think we're going to need to look at how we get more people health insurance. This has put a shining light on people who don't have health insurance and how that can affect every one of us. And if someone is exposed to this virus and does not have health insurance, are we discouraging that person? So I think we need to continue to look for ways to expand health insurance. And I'll let my colleagues up here to say what they want to say about that.
What we've seen in the past when we've had economic downturns like this is we've seen that revenue decreases in our state and our local governments have led to more job cuts and furloughs and have just kind of kept the pain of the recession going. We've got a lot of people right now who are immediately out of work, but as the state and the local municipalities continue to try to balance their budget in the coming days, it's my hope that the federal government will continue to provide us guidance so that we can spend some of that money on some of the shortfall. For instance, one of the ones that I know we all up here had some agreement on is we wanted to try to help out the Department of Transportation and some of the revenue shortfalls they're having as a result of the people not driving as much. We need federal guidance on that so that we've set the $300 million to the side so it's there as soon as the federal guidance comes. We can spend that money and help save some jobs and keep projects going both in the public sector and the private sector. So I hope we'll be able to address that very soon.
Well, of course, after this, we were getting projections that our state budget we could have a deficit of $3.5 to $4 billion as a result of this. So we know that while we've taken care of these critical needs right now, there certainly are more critical needs to take care of. But then going into next year's budget, when schools open back up, when things are running back, we have to pay for all those things. So we need to make sure that we are prudent in how we spend this money so that we have funds there should the shortfall continue on into the fall and into the spring. And to put that in perspective, our state budget is roughly around $24 billion total. So a $4 billion shortfall is very significant on that. So one of the things that the COVID committees in the House are going to be working on for these next couple of weeks while we're not having House votes, we'll be getting some projections. What are we looking at for next year? What do we know we're going to need for education? I mean, schools, while schools are being taught online, we know that the way it had to happen so quickly. And by the way, my hat's off to the folks who are doing this there on the ground, the teachers, administrators, the families and the students who are doing this. But we know that it's not been a perfect system. And we know that going into next year's school year that these kids, particularly in those ages between kindergarten and fifth grade, are going to need some remedial help to make sure that they're able to get caught up and get back up to grade level. The data talking about the need for the ability to read by the third grade is critical. So we're going to need to make sure we invest there. Same too with our community colleges and our universities. So we're going to be looking very carefully at making sure that we've right-sized that. Representative Jackson pointed out the need to make sure that we get funds to DOT. The Department of Transportation was having some challenges before COVID-19. And so, we've put money in from the General Assembly, but we know that we must keep the road projects going. We have to maintain our infrastructure. We have to expand where we need it, and we're going to have to invest there. So looking at creative ideas of how we do that going forward into the fall, into the next year, whether it's appropriations, whether it's a bond, whatever it is, we know that we're going to need to continue to invest there. But this first amount of money, while it's going to help right now provide a lot of immediate need, certainly is not going to solve the whole problem. And as we get into the full operations of state government, staring down a potential $4 billion shortfall with roughly only $3.4 billion available, the math doesn't add up. So we're going to have to make some tough decisions in the coming weeks and coming months. And my hope is just in the same way that we collaboratively and with consensus approach this, that we're able to do that as well.
So actually, based on the comments I've heard so far, I'm optimistic that we will be able to find some consensus and some common ground. The challenge that we face at this point is not only trying to deal directly with the COVID-19 direct repercussions. The other challenge is how do we make sure that we fund state government in a fashion that's necessary and appropriate. Going into this crisis, we were in a very strong fiscal position. We had about $1.2 billion sitting in our rainy day fund. We had probably a little over $2 billion that was unappropriated in the general fund budget. We were in good shape. However, as you've heard, the amount of the shortfall that we're looking at in our revenues for the next fiscal year could be approaching $4 billion or more. All of a sudden, that rainy day fund is inadequate to cover something like that. So what we're looking for, as Representative Jackson indicated, is updated guidance from the federal government so that we can utilize some of those dollars that they have sent to North Carolina to make sure that our schools are funded next fiscal year, to make sure that we don't, as happened in the last recession, we don't end up laying off teachers and cutting education. It's going to be quite a challenge, and I know the folks up here are interested in trying to make sure that we come up with consensus solutions to those challenges.
And I agree with everything that's been said, but I'd also like to add that over the next month or 2 months, we haven't been through this COVID-19 experience before, but we don't know what the unanticipated things might be. And so we haven't been able to plan for that yet. And it may be that something that's unanticipated would jump to the head of the line. And we need, not totally the head of the line, but somewhere near the front. And we need to be in a position to deal with that if it happens while we're in session during the summer.
Would also like to note that I think we all understand that we're going to have to look at some potential fiscal cuts to get where we need to be with our constitutional mandate of a balanced budget. But also important is the bipartisan request made by the National Governors Association of Congress and the President for $500 billion to help states across the country and local governments across the country avoid bankruptcy and making sure that people can backfill their budgets. And there's a strong movement for that to happen. I hope that we can get help from the federal government for this, because we do have a constitutional requirement for a balanced budget. We're all going to have to figure out how to get there. We also need to make investments that are going to help us save money in the long run. I think when you look at preventive health care and things that we can do in the healthcare arena, particularly with this COVID virus that has hit us, I think those kinds of investments are positive, and trying to draw down federal funds as much as we can is positive too. Next question, please.
Andrea Blanford, ABC 11.
Hi, Governor. It's Andrea Blanford with ABC 11. When businesses reopen, will people who refuse to go back to work because they simply just do not feel safe enough re-entering the workforce and their particular office space, will they lose their unemployment benefits? Are there any protections in the works or in place that would apply here? Thank you.
Yes, there are some protections, and I think this is something that we're going to have to deal with as we go along, because we do know that a lot of people are classified as at risk. There are a lot of people who are concerned about their health. So generally, I think employers have been, on a whole, pretty good in working with their employees, and we're going to continue to encourage employers to do that. But we may have to look at some potential changes in the law, changes in unemployment insurance, to make sure, number one, that employees are protected, but number two, that employers can have workers to get the economy reignited. We know that that is important, and we're going to all work together to make sure that our economy can get going, but we want to do it in a safe way, and we don't want to put any employee in a risky situation, and we've got to all work together to make sure that that can happen. Next question, please.
Richard Craver, Winston-Salem Journal.
Yes, this is Richard Craver with the Winston-Salem Journal. Just following up on the unemployment insurance questions, is there any consideration about reopening the economy to a degree that might end up impacting the number of people who either qualify for unemployment or are drawing it out? I know some neighboring states that's become an issue where there's a sense that reopening may be to lower the number of people on unemployment as much as to try to get people back to work.
Thank you for that question. We have a lot of people in the workforce now. In our executive order, businesses that might otherwise be deemed as non-essential, if they could social distance, could qualify as being essential. So we do have a lot of businesses that are open now. And as we begin the different phases of protection for our state and the easing of restrictions, there will be more opportunities for people to work. And I think you still have a lot of people out there who want to work. For example, we got, about 1,000 applications for contact? 4,000 now, up to 4,000 now. That was the first day, I guess. 4,000 applications for 250 additional contact tracers, which we know is going to be important. So we hope that as more and more businesses that aren't already open begin to reopen through our phased-in process, that they will have the workforce. I think it will be a challenge because there are still concerns about people's safety. And one of the things that our phased-in work does, and our looking at indicators and you making decisions based on science and evidence and data and facts, can make both employees and customers feel safer and more secure, because we're going to have to get all of them to buy into what we're doing in order to reignite the economy. Because you can open a restaurant, but if people don't come, then you're going to have a problem. So we need to make sure that we're doing things the right way. People have confidence that we have made a decision that a restriction can be eased based on science and data, and that we're going to require that businesses to take steps to protect you as a customer and to protect you as an employee, then that's going to make people feel safer, and I think we will be more successful in reigniting our economy as we go forward. We all know that we have to do that, and I'm firmly committed to doing that. Thanks. Next question, please.
Garrett Bergquist, Spectrum News.
Good afternoon, Governor. Garrett Bergquist with Spectrum News. Two kind of somewhat disparate questions here. First, to what extent are congregate living facilities driving most of the current numbers that we're seeing day to day in infections, and how might that be taken into account on the issue of reopening the state? And then second, with regard to reopening the state, we're starting to see more and more protests at the local level of the current state of things. I guess, what are you hearing from local officials about what they're hearing from their constituents? What do you say to them, and what do you say to those protesters?
Everybody's anxious to get out of their homes. A lot of people are anxious to get back to work and to see their business do better if they're in business now, or restarting their business if it's closed now. And I agree with that. However, as I said earlier, if we don't make sure that it is safe and we don't bring the people along with us, both the customers and the employees, then it won't work the way that we want it to. We also know that this virus does not respect county lines, and that people often live in one county, work in another county, shop in another county, and you can spread the virus in that way. We are open to making some regional decisions as we go along, and that is certainly something that we are going to consider as we go forward. Our congregate living facilities are a large part of the positives that we have, and this is why they are going to continue to be treated in the same way as we move through the phasing process, because it is so important in order to be able to protect them. But remember, too, that you have staff members who leave the congregate care facility and end up going home and going back into their communities. So we have to remember that more spread of the virus can be a potential problem for these congregate care facilities, even though a lot of our positives are coming from there. Dr. Cohen, would you want to add to that?
Thank you, Governor. As we've talked about over a number of weeks, there are 4 metrics that we're looking at. We're looking at our surveillance data. We're looking at our daily case counts. We're looking at the % positive tests as a percentage of total. And then we're looking at our hospitalizations. And you all can follow along in that data with us on our dashboard. And you can see largely we've been relatively stable. We're not seeing declines yet, but we also know in North Carolina we didn't have a peak or a surge like some other states have. So while we're largely stable, you are right that the congregate living settings, because we've been largely stable, we are seeing a lot of our cases come from those settings. And that is something that we take into a context as we're thinking about those 4 metrics, and as the governor said, why it continues to be a top priority for us, and we continue to protect those folks moving forward. Thank you.
Thank you. Next question, please.
Our final question today will be from Chandler Morgan, WBTV.
Hi, Governor Cooper. This is Chandler Morgan from WBTV. We've had a few viewers reach out to us just asking for some clarification on if you were to reopen this weekend and then come next Monday, you see numbers dramatically increase. What does that look like? Are we back to square one with the stay-at-home order we're currently living through, or does that mean like a partial pullback? What does that look like?
What is important is when you look at these trends and indicators over a 14-day period. That's why it makes it a little bit difficult to make decisions ahead, and why you need to look at the data for about 14 days at least to determine really where you are. So as we make decisions about what happens this weekend and going into phase 1, we've said from the beginning that if there is a spike or if these numbers really go the wrong way, that we could potentially go back to another phase, because we want to make sure that we save lives. We don't want to do that, and that's why we're deliberate about going to the next phase. And as we go into phase 1, we'll look at that for at least 2 weeks and potentially 3 or more, depending on how the data looks, before we go into phase 2. And then once again, you need at least a 14-day period to be able to see how you're doing, because we know that when you catch the virus, then there's a period of time before symptoms start to show up, and then a period of time before you test positive. So we're going to continue to look at all of those, and we're hoping that we can go and get through these phases, prevent a spike in North Carolina, and to keep people safe and to get the economy reignited at the same time. I want to thank all of you all for being with us today as we celebrate signing these 2 important bills that everybody in the legislature has worked so hard on. I commend this legislative leadership that is behind me. I commend all of the members of the General Assembly and their staff and our staff in the governor's office who worked so hard to get this done. And as we go into future legislative sessions, we hope that we can do even more for the people of our state. Thank you all for joining us.